Hello everyone, welcome to Talking Health with Dr. Laz, your favorite health program on television, reaching you from Nigeria's capital city, Abuja. My name is Dr. Laz Eze. Yes, we're very excited today because a couple of days ago, especially July 18, Talk Health Niger turned 7. Yes, it's just like yesterday when I started this idea of using a language that most resonate with Nigerians to communicate health. And it was like a radio program actually. We started in Pidgin English to create more awareness and increase health literacy. And of course that has continued and moved to a Pidgin English health blog, perhaps the first and only one in the African continent, and also this program that Dark Communications provided a very rare opportunity last year. It's interesting to know that on 18th August, we're also going to be marking like first year of Talking Health with Dr. Laz. So really appreciate everyone that has made Talk Health Niger, helped in one way or the other, the volunteers, all the partners, and everyone that has encouraged, and those that have kept watching this program and following talkhealthniger.com blog, and all the ways that we're passing health information, but for you, will not get it. But there's still so much more to do, and we are going to keep doing that with our partners like Dark Communications and all other partners to make sure that we increase health literacy and also make every Nigerian have sufficient information to make decisions that is going to impact positively on their health, because that's essentially why we exist. So we look forward to more partnerships and support in different ways to keep getting this information out. So having said that, on the program today, what we're going to be focusing is also related to why we exist, to increase health knowledge and also influence health behavior. So we're going to be discussing appropriate health-seeking behaviors. So we'll define what health-seeking behavior is and also talk about the various factors that determine how we behave when we have a need to attend to our health. So I will have a public health expert who is going to join me on the program today, and we are going to deep dive and talk a whole lot about this. So once again, happy 7 years to Talk Health Niger and to all of us that are part of this team. And we're going to take a break, and when we return, we'll continue with this program. Do stay with us, we'll be right back. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. Yes, we are 7 years old and we've been trying to increase health literacy. There's so much more to be done, and everybody should be a part of this in sharing health information, accurate health information. So health-seeking behavior is our topic, and with me is Chukwunonso Umeh, who is a public health expert, bachelor in public health, masters in public health, and also having worked with a lot of health programs and health interventions in Nigeria. You're welcome to the program, Mr. Umeh.
Thank you very much, Dr. Laz.
Right. So health-seeking behavior, you recall in the public health space, those health behavior theories, health education, health promotion, health information, health communications. It's like the basics of public health.
Exactly.
So kindly explain what health-seeking behavior entails, perhaps to a layman in quotes.
All right. So just in a nutshell, in an easy way that a layman could understand it, health-seeking behavior are any action or inaction taken by someone who perceives that he's not feeling well or sick and needed actually to regain his health. Right. Because any action you take at that point is for you to bring back your initial status in terms of being healthy once more again.
Okay, so keywords action or inaction.
Exactly.
So which speaks to what the person does or what the person feels to do.
Exactly.
Right.
Or even what the person avoids doing. So,
Okay.
yeah, exactly. So if, for example, you're having liver cirrhosis and you're asked to stop taking alcohol, so the inaction is you stopping it entirely. The action part of it is you going ahead to take that alcohol.
Okay.
Do you understand?
Okay, so it's very interesting because we're still undergoing the COVID-19 pandemic.
Exactly.
And cholera outbreak, you
Sure.
know, is ravaging the country. FCT have reported cases, Niger State, Ebonyi State, so many states have reported cholera. And these things are health conditions that have to do with behaviors.
Exactly.
And also, Lassa fever usually occurs in the, you know, so many even non-communicable diseases.
Exactly.
So what are those factors, you know, the determinants that influence how people behave?
All right. So there are actually myriads of factors, but I will start from knowing that we are Africans, exactly. So I'll start from the socio-cultural and the geographical component. Sex has a role to play, so culture has
And
a...
by saying you mean gender,
Gender, so
male or
exactly,
female,
male or
so
female.
that people don't understand
Don't
the
misunderstand
other
it,
meaning.
exactly.
Yeah.
So in terms of being male or female. So likewise, culture has a big role to play. In some culture, there are certain things that when you are feeling sick, they say you should do this or do that. Some of them are not even healthy. So that's
Okay,
why we say
maybe-
appropriate health-seeking behavior.
Right.
Yeah.
Maybe for each of them, we try to play it on. Okay, let's say whether one is male or female.
All right.
How does that determine how we behave towards our health?
Exactly. So there are some diseases that are attributed to only female, for example, which you know that is actually wrong. So just that gradually awareness and sensitization has been on, and people have started seeing that actually, for example, cancer is not just meant for women.
Which cancer? Breast cancer,
Breast cancer,
right?
yeah.
Yes, breast cancer
Exactly.
can affect men
Men
or
and
women.
yes, but whenever you mention breast cancer,
People think
by
women.
default, exactly. So by default, so it's very difficult for a man to actually come to the terms that I might have breast cancer. So when you tell you have a breast cancer, you say, for what? I'm a man. Do you understand? So you can see the role that male or female actually play. So
Yes,
in their
but
belief,
beyond that, I think
yeah.
there's many studies have shown
Yeah.
that females tend to have more appropriate health-seeking behavior.
Yeah.
Like when they feel somehow, they are more likely going to go to a clinic and see a healthcare provider compared to men.
Exactly.
Some will say, okay, they will attribute it to something and say, get me some drinks.
Exactly.
And they wave that away until maybe because they will tell you, don't worry, be a man. And the man is having severe pains.
Is the cultural
and they'll say, be a
it
man.
relates to the cultural components that we mentioned about. So, you know, our society also give that illusion that if you're a man, so you are both some things, certain levels of pains, some diseases that shouldn't even affect you. You should be strong enough, that kind of thing. Let me use that word. Do you understand? So you see that society molding that component. Even when you're actually dying out of it, you're trying to say that, let me man up, that this disease is not meant for me. Do you understand? So it also has that cultural connotation.
Okay.
Yeah.
So what's other factor? I think religion is a key factor.
Very, very much.
And in terms of religion, I think different persons may have different perspectives to this. But from my experience in clinical practice, I think religion is doing a lot of good in a number of areas, and it's also doing a lot of damage in certain areas. And it's something that the authorities really need to pay attention to. Let me give you an example. When I was working at the University of Abuja Teaching Hospital, I was at the O&G, the obstetrics unit. We are on call at the labor ward. And we had this patient that was brought in as an emergency and brought from a delivery home, which is a church, a religious home, you know, so where the woman has been in labor for 3 days.
Whoa.
And they were using holy water, you know, doing all sorts of prayers and all that. It doesn't mean that prayers do not work, right? You know, but I think that God gave man, you know, some powers of creation through which medical discoveries are a number of stuff. So the woman came, by then the baby is already gone, you know, in utero. The labor was not progressing. He had what we call tomato vulva, and there was a whole lot of complications. So they brought the woman, dumped her in the hospital, and ran away, right? You know, so what do you think about some of these practices? Because through the words at the religious places, it kind of influences, instead of people going to the hospital to deliver, they go to a religious home to deliver, like a Hebrew woman or something like that. So what are your thoughts on how this could be addressed?
I think one key thing is, which is one of the things we're going to also discuss today, is that sensitization of the religious leaders. Most of them actually went through, let me use the word, theological schools, whether Islam or Christian, as the case may be, and not so in-depth, don't have that in-depth knowledge on health and what they should do. Do you understand? If so and so thing happens. And most often, they believe that you're being spoken to by the Holy Spirit. You woke up in the morning and say, I was told that that malaria should not kill you, just for example, I'm just citing, which is not true actually, will not kill you if you take just water, or as the case may be. But if they are sensitized, knowing the risk of not doing A or B when somebody is at the risk of A or B, do you understand? We actually go a long way in informing and molding their ideologies in when they are engaging the populace. Because one key thing, they have a very big role to play, knowing that in Africa we are very religious, not to talk of even Nigeria. So we are very religious. So we sometimes you see people even obey their pastors even more than any other person in the world, or obey their imam as more than any other person in the world. So which means they have a very key role to play in terms of having those requisite knowledge that they should use to engage their
So will you recommend that for religious homes that engage in some level of health practice, that because there's hardly any religious organization that you will not find midwives or some persons with health background?
Exactly.
You know, they should have a clinic, engage midwives, nurses, doctors, depending on the level they want to run. Of course, primary health care.
Exactly.
You know, and of course, with the prayers and the appropriate medical skills, they will give the best to their patients.
Exactly. So, you know, let me use Christianity as a point of example. Practically, in almost every religious body, you have is a kind of small group that's called a health team, as the case may be. But there's often that little or no linkage between them and the leadership of those organizations. So in the sense that in as much as they are there to provide those things, when the imam or the pastor or the priest mounts the pulpit to speak to them, he's not speaking to them because they don't even have time to actually come and tell him these are the things that should be done. So they're actually attending to other congregations, not actually linking up to him. So if there is possibility of having meetings or sensitization or training, whereby they have to put the religious leader through on what actually is the process of what they do, it helps in a long way.
It's going to help. Okay, so we're going to take another break, and when we return, we run through the other, you know, factors or determinants for health-seeking behavior. Please stay with us. We'll be right back. Welcome back to Talking Here with Dr. Laz, your favorite health program on television. This is actually episode 44, and we are talking about health-seeking behaviors, the factors that determine the actions, what we do or what we do not do when we feel the need to attend to our health. And with me is a public health expert, Chukwunonso Umeh. So let's continue, Mr. Umeh. We've talked about the gender, we talked about culture,
sex.
We spend a lot of time on religion. So what about awareness and knowledge?
Exactly.
So let's quickly go through. I have some. I've taken the awareness and knowledge, affordability, you know, distance to healthcare facilities, you know. So awareness and knowledge. How does it affect these health-seeking behaviors, and what do we need to do? Of course, it's part of what we are doing on this program.
Exactly. So you just took the words from my mouth. All right. So interestingly, awareness and sensitization is one key thing that actually makes people to know when you are even sick. Let me start from as simple as that. For you to even know that I'm sick goes a long way for you to start recovering yourself in terms of if I'm having headache, I need to go for test or I need to take paracetamol. So you can see that's a help-seeking behavior because I actually knew that I have headache, right? Then there's need for people to be sensitized. there's need for people to know, have an idea of those things they need to look out for.
Okay.
So in terms of, for
Because
example,
of time,
cancer
I'll
and rest
stop
of
you
them lungs,
around
okay.
that, but let me add that the health education is community-based.
Exactly.
So every local government should have a health educator. Is a profession, is actually an aspect of public health.
Yeah.
And every community should leverage, like for instance, we are going to August. In southeast part of the country, usually have August meetings. They should use that and get people to educate them around topical health issues.
Sure.
And I think this week is also Ide Kabir.
Yes.
You know, people will meet, families will meet. At every of those social outings, please
use an opportunity.
Include health. So access, affordability.
Yes. So affordability plays a very key role in terms of if I don't have even 100 naira to boast of for the whole week, the tendency for me to even overlook anything that relates to seeking health is there, because I don't even have the fund.
Right.
Exactly, to go to
So
hospital.
how do we sort that out? Health insurance, universal health coverage?
Health insurance goes a long way to do that. But in as much as the health insurance, he also needs money for at least some stipend for the health insurance component. So which means there's a component that looks at the economic status. So how do we strengthen people, for people to start no matter how little business, so that you can have something to even put into the health insurance?
Okay.
Yeah.
So, but you know, the health insurance, there are people you have to contribute. I think many states that form their health insurance agencies put in like 12,000 for basic per year, per annum, you know, per person. And of course, we can argue that it's not everybody that can easily afford that. But those who can afford can use the adoption method, which we've discussed on this program. So instead of buying certain gifts for people, you can pay health insurance for people if
for
you can afford
a year.
it. Yeah, for a year.
Yes.
So if you take 1.2 million, if you can afford it, that pays for up to 100 persons in your community.
Exactly.
And that will actually help.
For the
so
whole
when
year.
people know that they have health insurance, they are more likely going to
visit
go to a health
clinic.
facility instead of
managing themselves. Exactly.
Okay, distance to health facility. Our time is really...
All right, so distance to health facility actually plays a big role, in the sense that you tend to go to a health facility when it is close by, so it's convenient for you to just walk in, than spending like about over 3 hours to get to a health facility. So that is very common in terms of common sense. That is practical.
Yeah, so sounds good. What about the quality of healthcare?
Exactly. So you tend to visit a health facility over again if the services you get there are of high quality. Exactly, satisfactory. So nobody insulted you.
That's a very key component, because for pregnant women, many studies have shown that they do not go to health center. They might go for antenatal care, but when it's time to deliver, they go elsewhere.
Sure. So just they feel scared or wouldn't want to be insulted or being shouted at, or as the case may be. So just receiving those poor services actually scare them away.
Right. So I think we're almost done. Just a couple of minutes to round up. Availability of life-saving commodities, essential medicines, and all that. What role does it play?
Okay, so it plays a big role in the sense that no drug, no program. So in terms of, if you don't have, no matter how you've been treated in a health facility, you're given the first class, given AC and drinks, and when it gets to the point of receiving your medicines and you're told we don't have any medicine, so you tend to lose interest in going to those health facilities. So you spend your whole day there and you can't even get drugs, which is the main thing that took you to those health facilities.
Yes, that's very right, because especially at night when you need some emergency drugs,
exactly, you can't even get them
within
outside
the health facility.
Yes,
with that experience, the person may actually be seeking other alternatives.
Exactly.
But there is this study done in Ibadan amongst civil servants. I think about 337 of them, published in Annals of Ibadan Medicine. They looked at health-seeking behaviors among civil servants, the Federal Secretariat in Ibadan. And a key finding, like the aspect of affordability, they looked at the wealth quantile, divided them into 4. So, and it shows that those are the lowest 4, that is bottom 25%, that lowest quantile. They are 6 times more likely to be engaged in inappropriate health-seeking behavior compared to those with at the top 25%.
All right, so it also speaks to those affordability components, that the pricing that we mentioned. So most of them, their salaries might be around 30,000, and they wouldn't want to risk spending the whole month's salary just for one visit to the hospital. So you see them going for alternative way that will make sense cheaper for them, which might not be safe.
Yes. So there's also another study done in Tanzania, Zambia, and Kenya.
Yeah.
Within a community, trying to look at the geographical locations and factors that influence, but that was mainly focused on women going for antenatal services and child health services.
Yeah.
You know, you mentioned the role of the behavior of the healthcare workers.
Yeah.
So that showed that they tend to withdraw from going for antenatal care and tend to use the alternative ones, whether at the religious homes or traditional bed, what we call traditional bed attendants, you know, in seeking care. So what do we need to do to make sure that health workers respect their patients and treat them with dignity?
Okay, so the accountability mechanism plays a big role in terms of most of those communities have PHCs, which PHCs are more in number, so they are designed to actually serve those communities. So in terms of bringing the accountability mechanism in means that you have to put them under the supervision of the community and letting the community know that they have a big role to play in the functionality of this health facility. And when they know that they have an eye on them and to checkmate whatever they're doing, so they tend to behave well. So that's one key thing at that lower level. Then at the higher level, in terms of secondary healthcare facilities, tertiary healthcare facilities, there is also a task force or mechanisms whereby they're being supervised regularly.
And by secondary healthcare facilities, that's the district hospitals,
general hospitals, as the case may be, exactly. Okay. Tertiary, talk about teaching hospitals, federal medical centers, and rest of them. They all have mechanisms of supervision. So the main thing is for them to be supervised, monitored. That's one key thing that happens.
Supervision and monitoring.
And also training them appropriately. Let them know what they're supposed to do.
Right. Yeah. And I also think that patient's bill of rights should be on the wall of every healthcare facility.
Yes.
Because like when you go to some facility, you see, even in some corporate organization, you see things on the wall.
Yeah.
So if people can put patient bill of rights, you have a right for this. And of course, healthcare workers have their rights. We've discussed that extensively on this program. But I really like the point you made about community participation.
Exactly.
In fact, in primary health care, you cannot have a strong primary health care without community participation.
Sure.
And by community participation, the minimum is that every community should have a health committee.
Sure.
That gives like a governance structure, because if at the community level you don't have a health committee, it's like a state not having a minister of health.
Exactly.
It's like a local government not having a department of health.
Yes.
So if they have a health committee, they have rules that's, you know, but it's entirely a different conversation. And that reminds me that you are part of the Make Our Hospital Work campaign.
Yes, sure. So we need to make our hospitals work.
We need to make our hospital work. Okay, thank you very much, Mr. Chukwunonso Umeh, public health expert and member of the Make Our Hospital Work campaign, for joining us on the program today.
Thank you very much. It's a pleasure, mine.
All right, and to you that watched us up to this point, we really thank you for being part of this program. And like we discussed, health-seeking behaviors is important. When you are unwell, please go to trained people who know what to do. Many times you spend more money when you are trying to cut corners, and that's the fact. So the first person to meet is go and see a doctor. If you don't have a doctor, go to a primary health care center and have anybody that is there to attend to you. The lab is not the first place to go when you are unhealthy. Of course, when you see a doctor or any of the primary health care providers, they will tell you the test to do. And when you do that test, you go back to them to interpret it and tell you what to do. So those are the appropriate things we need to do. And also every year try to check, because hypertension doesn't give sign until it gets complications. So I wish we have more time to continue, but that's where we have to close the program today. My name is Dr. Laz Eze. See you same station, same time next week. Bye for now.